Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we're super excited to have you here. We're here because we want to bring some exciting conversations with real leaders that are painstakingly shaping the future of healthcare. And we happen to be crazy passionate around healthcare innovation, adoption, leadership, and access. And if it's your first time tuning in, let me just sort of quickly tell you a little bit about what we're really trying to get done here. So the focus is actually bringing stories of innovation within our space to life. The aim is highlighting real people that are actually getting stuff done, and giving them the opportunity to share their story with our community and our platform and ultimately with the world. We've got an amazing action-packed year. If you haven't checked out any historical interviews, make sure you do that right now. And if you want to have any of the new interviews, come right to your inbox. Make sure wherever you are, just please hit the subscribe button now so that you can check things out. So our field, things are constantly evolving. There's a lot of change, and it's crucial to have leaders that are envisioning the future differently, eagerly embracing innovation and addressing pressing challenges. And our next guest on the show is one of these leaders that's doing something that's pretty pivotal within our space. I'm thrilled to be having a conversation with Bruce Springer, the chairman and CEO of Prolucent Health. He's a trailblazer when it comes to addressing one of the most pressing challenges within our space, workforce optimization. With decades of experience leading high growth companies within our space, Bruce brings a unique blend of entrepreneurial vision and strategic execution to the table. So, under Bruce's leadership, Prolucent has become a driving force in leveraging innovative technology to tackle talent shortages, enhance operational efficiencies, and empower healthcare organizations with unparalleled insights into workforce dynamics that they didn't necessarily have access to before. So Bruce is constantly pushing the boundaries of what's possible. And today I get to kind of dig into a little bit of Bruce's journey, his story, his leadership, his philosophy, and some of the groundbreaking work he and his team are doing at Prolucent Health to really revolutionize workforce. So Bruce, welcome to the show. It's great to see you. How you doing?
Oh, great. Great to be here, Michael. Thank you so much. I hope I can live up to that wonderful introduction you just gave me.
Of course, of course. So just before we kind of really dig into your story, can you share a little bit about your journey into healthcare leadership and what drives you every day?
Yeah, so I backed into healthcare when I was 25, 26 years old. I met another young gentleman who wanted to start a business in the healthcare space and ended up joining him and founding WebMD. And I named that company back in 1996. And that was kind of my first foray in my MBA program in healthcare. I got to see both the consumer side,
Hmm.
pharmaceutical, the claims, the lab, and how that all worked, and trying to figure out how to piece together a solution that, sort of revolutionized the market. And I fell in love with how to innovate in healthcare to really make a difference.
Yeah.
And I've stayed in healthcare ever since. And I founded a company in 2003 called BidShift, which was helping hospitals fill open shifts and
Hmm.
sourcing labor directly to build
Hmm.
flexible pools to reduce their reliance on external agencies. And I've been in that workforce space on an ongoing basis for probably more than the last 20 years, and really found a niche and an opportunity to really help health systems, you know, innovate in that area to be able to compete in a much better way. And the COVID crisis obviously accelerated that
Yeah.
pain. They
Yeah.
accelerated that process and that need. And sometimes it's better to be lucky than good. We're in the right space at the right time when health systems really needed to innovate and find new ways to move.
Yeah. So when you were innovating back during the WebMD days and innovating, throughout sort of different tours of duty, has how you've defined innovation evolved throughout the course of that time, or has it stayed constant? And what is that?
I think it's funny, you look at it, workforce in specific, the same challenge that existed 20 years ago seem to be existing today.
Yeah.
And so defining innovation is different, but the challenges we're trying to solve and how we're using technology to solve them is different. But similar challenges that existed 20 years ago seem to still exist today. And hopefully we can innovate our way out of those challenges over the next 5 to 10 years.
What do you think have been some of the biggest myths that people have been led to believe around some of these workforce challenges that we're facing?
Well, during COVID, a $19 billion healthcare staffing market grew to $69 billion on the backs of health systems, basically. And the myth, and all of a sudden, bill rates are coming down, and oh, wait, the problem's solved. We're good. As long as there's not another crisis in front of us, we're stabilized. The reality is the staffing market goes in cycles, and the changing and evolving worker needs and demands are changing as younger workers are looking for more flexibility. And so the fact that that we're in a good place today and that costs are
Well, how do
better,
you
margins have
define good?
improved.
Who's defining good? Like, what is that?
Well, you saw for a long time, 90 to 95% of health systems were losing money. Margins were negative, labor costs were skyrocketing, and now you start to see that that's come down to, I think it's around 38-40% of health systems have negative margins. You're starting to see some healthy margins in the for-profit sector, but you're still seeing significant challenges in the rural sector where there's not a big labor supply and a labor pool to pull from. And so there's still folks out there that are suffering from significant workforce costs that seem to be out of reach for some. And they're not. There's just, you got to look at different ways to innovate and model to bring that cost in line.
Mm. I mean, so you and your team, you guys are known for having sort of innovative solutions. What's a recent example of an innovation that you and your team have deployed that you're particularly proud of?
Yeah, so I think, trying to do everything all at once and boil the ocean is hard in health systems. And there's so many things in workforce that you can focus on, whether that's sourcing and recruiting, building your own internal flexible pool to managing external contract labor. And the other problem is disparity of data, siloed data that are living in their existing technology systems, but those aren't integrating. So I don't know real time what's happening across my organization. And I also don't have the market data to really understand how do I fit into this market and where's my competition, what's the cost, all those different things. One of the things that we have done is on one platform, be able to pull together the ability to unlock all that data, to integrate with all of the existing technologies that the health system works with, and then launch a flexible workforce platform that manages all that flexible labor, be it their own internal labor that they're controlling, as well as
Mm.
external labor, all on one platform, to be able to standardize credentialing, compliance, payments, to have the data to really understand compensation structures and strategies and how to implement those and have the tools to actually make that happen. I think that's been a huge accomplishment. Those have been siloed pieces, and by bringing those together, really unlock significant value for the health system.
The health systems are really, they're still grappling with what you just listed. Which one do you kind of try to approach first to solve? Or do you feel like you've been to one health system, you've been to one hospital, they've got a different issue than another one? How do you sort of navigate that landscape? Because, when you're doing something that's, you know, disrupting the norm, I'm just sort of curious how you try to thread that needle.
Well, we try and be consultative with our customers to bring data to help highlight where we see the issues and then collaborate with them to understand what they're seeing, where their bottlenecks, where their issues are, whether it's cost, whether it's operational improvement, what it is. And then we really dig in. We call it our healthcare workforce blueprint. We really work with them to understand where those pains are and then prioritize where you can create the biggest gains, the biggest wins, whether that's operational efficiency, cost savings, ROI, you name it. So every health system, as you said, is different. They've all tried different things, are all working with different vendors, all different technologies. We go in and really just trying to understand where they are, where they're going, and how do we help them get there. We like to say we like to meet them where they are. So where is
Mm.
the greatest pain and how can we work with you to help solve that pain? And we bring our skill set and our consultative capabilities and our data to bear to help them isolate where those opportunities are. And at the end of it, we create we call it a workforce optimization blueprint because it's a path. It's like building a home.
Yeah.
Where do
Yeah.
I start and how do I get to the end game? And then how do I build you along that path to get to that finished home that we can all live in and be happy with, right? Where
Yeah.
everything's working, the plumbing's working, the electrical's working. I got a pool in the backyard, it's all working, everything's working together, right? And it's a good home to be in. That's where we kind of strive to get to the house since to that point.
My question is, you mentioned around a very interesting stat about how the industry sort of ballooned up to a peak at 69 billion. You had mentioned it's come back down since then. Do you feel as though that there's a bit of uh, reticence? Folks are jaded by that, and is there any apprehension when you're kind of coming in and talking about, hey, we want to look at this workforce blueprint? Do you still get that level of whether I don't know if it's resentment, I don't know what the right word is, but there's a level of hesitation on their behalf, just given everything that health systems have been through. How do you get through that? Is it really more relational, or is it, hey, we're doing something that's totally different here, that's completely unique? I'd just love to kind of get maybe your take on that.
Well, as you said earlier, one health system is one health system. So when you go in with what we do, HR has a role in that, right? Because they're hiring a full-time staff, building an internal pool. A lot of times nursing is heavily involved. And then you have locums, and the physician is separate from the nursing side, which is separate sometimes from allied. And they've got multiple decision makers, multiple processes, multiple technologies, multiple solutions in there. And so at the end of the day, we try and get in and be consultative to help them understand. And sometimes, so we signed a customer in Boston who had a pain point in a specific area, and we're focused on that pain point. And that's
Right.
the only thing. But then they're like, oh, well, can you do these things? How can we help move some of these other things along? So again, we want to meet them where they are and help them solve a actual problem that they're dealing with, and then move forward from there. And you can do these in bite sizes and not in holistic chunks.
Mm.
Um, but there is some reticence. The health systems got burned by staffing agencies during the COVID. The bill rates on average of a $90 an hour nurse for a travel nurse ballooned up to 150, 200, some markets $300. The profit, same level of service was being provided,
Yeah.
but the margins and the cost increased. And oh, by the way, 100,000 nurses alone moved into the travel market because all of a sudden they could get paid a lot of money and have to work a short amount of time to make the same thing they were working full time. Where did those nurses come from? They came from the health systems. And then the health systems were buying that talent back, right? And so one of the things that we pride ourselves on is we're not a competitor. We don't W-2 staff. We're not trying to source labor. We're vendor neutral. We are 100% focused on how do we leverage technology to upgrade the capability of the health system to compete for labor and to drive down their labor costs. And so we don't have skin in the game. We're not tied to, oh, if I get that order, I'm trying to maintain my margin on that labor on one side at the cost of the health system. We're in there trying to figure out how to help the health system drive that margin down, that cost down for all of that labor.
How difficult is it for a health system to actually be able to get some of these insights? And maybe this is just me thinking out loud. Maybe this is a foolish question, but how come how come they don't have that information readily available to them, and knowing what their competitors are doing? Talk to me about that.
Yeah, they could go to their competitors' career sites and say, go look up jobs and see what they're being posted at and what's
Right.
there's comp posted. It's a tedious thing to do. And so it's very hard for them to do that. And then access to agency data, the lack of transparency that has historically been around workforce has caused this gap of knowledge to really understand what is the agency charging me and how do they get to those rates and those numbers. We're called Prolucent. If you break down Prolucent, Pro is for and Lucent is for transparency. We built this business to bring transparency to the market. One of the things in one of our assets is we pull every job from every health system in the United States every day. Every provider of care, long-term care, acute, subacute, you name it. and we pull in every job. So we actually know across the United States what the supply looks like, what the costs look like, what the structures, who's providing signing bonuses. We use our AI to parse that data and really look at job descriptions, roles,
Mm.
responsibilities, like years of experience, education levels to really understand deeply what's happening. We also pull in agencies data. So we know what they're paying and what's happening in that market and how they're competing in that same market for that labor to really get a holistic picture of what's going on to really help inform the health systems where they really have not had access to that information. And that data and that reporting is just part of our service that we provide as a customer.
And that's pretty neat. Can you maybe even just sort of share a story or even feedback from any of your customers that have been, impacted by the work that you and the team are doing?
Yeah, I mean, we have lots of case studies of customers and the output. Just simple stories like one health system who's a data customer called us and said, "Hey, three of our skilled nursing areas, our volume dropped, our applicant volume dropped 80, 90%. We don't understand why." And within minutes, we were able to pull up because these three competing health systems are offering 10 to $25,000 signing bonuses. And so they are able to pull a report and immediately walk into the CHRO, the CFO, and say, "Hey, we're going to have a problem sourcing this labor if we don't look at making a change to our comp structure." So just real-time insights like that, that they don't have to go search and hunt and peck for. They can actually get access to that information. We have another customer who was using an agency as their MSP, and they had their own internal tech trying to manage
Right.
their pool. We're now the single order management submission for both internal and external. And every morning at 5 a.m., we send a report out of everybody who's working in the health system to every one of the management in the health system. They're like,
Mm.
"Where did this come from?" They used to call it the Frankenstein report because they had to pull it from 30 different places to try and create it, and they didn't know how accurate it was. Well, now they've standardized on us. We can provide that level of detail and reporting on a daily, hourly, real-time basis as they want to look at various aspects of what's happening in their employment base.
Well, you're seeing a lot of consolidation happening within the market, within health systems. Where do you feel like Prolucent fits into that whole entire, situation?
Well, that's actually a positive piece for us, meaning when health systems buy another health system or another hospital, they're on different tech. Have different solutions, they have different providers, and all of a sudden, okay, my recruiters that are working in my main health system don't have access and can't help that new hospital or this new health system we just merged with. So you have disparate systems. We can actually integrate to all of those applicant tracking systems, for instance, and create a centralized career staff, centralized recruiting platform without them having to rip and replace their existing technology. When they also look to do those mergers, it's an inflection point. How can I
Mm.
innovate? How can I do this differently? Right. And now I've got more scale. I've got more issues. Right. And if I don't solve this, this is going to be problematic. And so those inflection points when they acquire or merge or grow are great opportunities for somebody like us to come in and really help them understand the market. Plus, they're moving in maybe into a new market that they don't know. And we can help provide that data and information to help them think through that.
So then it becomes less reactive and rather more proactive than in terms of what you're doing.
Yeah, and that's one of the benefits, for our customers. So for instance, on the contingent agency side, the travel or the agency side, a lot of times it's, "Oh, wait, I have a need. Let me get somebody and let me put them in." We actually, with our customers, predictively can help them because we know all their full-time hires, we know all their open positions, we know how many candidates
Right.
they have, know what their conversion rate's going to be. We know what they're probably going to hire over the next 30, 60, 90 days based on that volume. And then we put in, fair medical leave and all the other things, absentees that you can look at historically, and we actually start to put a roadmap together and say, "This is what it's going to look like over the next 90 days. Let's start planning ahead." And our customers work with us to help them set their budgeting for the next year. What does that look like?
Mm.
What is that going to be impacted based on where we are today? So we want to be proactive. We want to be on the front foot, helping the health system solve it. And the earlier you solve it, the less expensive it is. When you do last minute hires, the costs go up.
That's
Well, if
right.
we start to predict this out and working with everybody in the ecosystem to drive the answers to the problems, we can actually bring down that overall cost, which is a big part of the benefit.
Is that also more more along the lines of sort of wraparound services that you and the team are offering outside of the technology that you're driving all of these insights with?
Yeah, so we have tech only. So if they just want us to provide the technology, the reporting, and
Yeah.
but there is a service component to all we do. We always want to help
Yeah,
them. It's not
there's
just here's the data, but what does it mean, and what should we be doing with this data, and what's the impact? We also do provide a service. So if they want to manage their own contract labor spend and they want to contract with those agencies, great. We'll come in and give them best practices. We'll help them figure out how to do it, how to structure those contracts to their benefit. But they can also outsource it to us, and we can take that on for them and help them manage that. Where we've deployed our MSP service side, we average 10, 12% bill rate reduction over what the hospital system was doing prior. So if they're spending $100 million, we typically can save 10 to $12 million out of the gate just on better management of the bill rates, better optimization of how they used the labor,
right.
why they use the labor, and then the contract terms to manage that labor efficiently without
Mm,
penalties or problems. And so everything we do has a consultative piece to it, whether they're buying
yeah,
the
that's right.
technology or they're engaging us as a tech-enabled service.
That's right. That's right.
Or, for instance, if they have a float pool, but they want to build a regional agency, like their own internal agency, sometimes they don't have the data or the comp strategy or structure. Sometimes they need the technology. Sometimes they say, can you help us? Can you do a piece of this for us and help us get this up and running until we can handle it ourselves? And the answer
So
is
a
yeah.
regional pool?
So if you have, say, float pools, which have been around forever, which is I have a group of, say, nurses that work in a specific hospital, specific unit, and when there's a call off, they pull from that pool. But what if I have extra nurses at one hospital, one float pool, but the hospital down the street or around the corner has a need? They're not
Right.
connected. So those that goes underutilized, so they go out to an agency or somebody else.
What if they're not part of the same health system? That can that interplay as well?
That can. So what the gig market staffing agencies have done is
Yeah.
said, hey, let me come in. And anybody who wants to pick up extra shifts can get credentialed on our platform and then they can get access to the needs and go work. But it's still a staffing company and they still put a margin on top of that labor. Why would a health system not want to have their own, be the employer of record for that pool of labor, not have to pay the agency fees, be able to access all the latent hours of workers in that market to work with them and to fill their needs at a lower cost. So we enable the ability for the health system to build a localized per diem or travel pool in their markets. What if they want to hire direct contract travelers and not
Right.
have that because they have enough distance between their facilities that why don't I want a nurse who's already licensed and credentialed on my network, who's already knows our health system, knows our ERP, all of our different system or all the things that we have that we use in our system. Why wouldn't I want them at one of my sister facilities instead of an outside nurse who's
Right.
coming, may not know and may not have that kind of training?
Well, if you're a health system, I'm just trying to think and put myself in the shoes of a health system. What are some of the associated risks of them doing something like this in-house? What risks do they take on by doing that? And I
Well,
guess
it's
why
not
why have they been so hesitant to do that?
it's not so much risk, it's cost because now I got to staff up for the staff that it takes to build this. I have to get technology, or otherwise I'm going to do this really inefficiently, which is typically what's
Yeah.
happening. And I don't have the comp data. I don't know how do I have to compete to get to that agency worker to come work for me
Right.
instead of working for somebody else. How do I structure this appropriately? So sometimes it's a little bit of know-how, sometimes it's tech, sometimes it's data, sometimes it's cost because I have to invest to save. Well, we don't force that. We can come in with a no risk market opportunity, which is you don't pay us until we help you drive savings or we reduce, cost and do things that help you the health system achieve its goals. And so we have the know-how to do those things, not only between myself, our founders have founded three large workforce companies that have been doing this for the last 20 plus years, and we came together to try and build the game winning end game solution that we thought was a winner for the health systems with the health system in mind. We have a nurse executive on our board. We back and support this. We have a chief nursing officer who used to be the president of AONL and the CNO and health systems. We have the former CHRO of Northwell, in our staff. So we have hospital expertise in our organization that paired with us as sort of technology workforce experts to bring to bear to help health systems solve problems.
You mentioned some around changing the pricing, like, hey, don't pay us until we save you. That's an interesting point because you're starting to see, and I don't even want to use this word vendors, but partners that are moving down that path. Has there been any reservations around going down that path, or was that just sort of a no-brainer for you and the team to say, hey, we need to deliver. If we can't deliver value to our customers, then like we ought to not be charging them if we're not delivering enough value.
Yeah, the good and the bad of the workforce market is there have been a million people who've jumped into this space, right? And more
Right.
importantly, the big staffing agencies all now say, I have a vendor neutral solution. I can do this for you. You
Well,
don't
how's
need
that
it
how's that how's that possible if they're the actual ones that are
because they're trying to
sourcing the talent?
monetize it. But at the end of the day, if they become the VMS of record for your system, that gives them un, non-competitive access to your orders, which gives them an advantage on the staffing side. So at the end of the day, there's a lot of folks and there's a lot of noise out there. And so partly we've always had this risk-free model. So when we come in, you're not coming out of pocket. You're not having to pay us out of your capital budgets or your operating budgets to get in here and start the work and start solving this. So that's kind of always been a part of the theory. And even more so now, where there's a lot more competition and, there's a lot of incumbents out there promising a lot of things to health systems. And then what we find out is it doesn't work. We had, there was a health system that we wanted to partner with. They brought in a new executive who decided I want to bring in the people I've worked with for the last 10 years in another health system. So we didn't get the business. And 2 years later, they're calling us and saying, that didn't work. That opportunity didn't work. We should have worked with you in the first place. And so
Mm,
there's just a lot of noise. There's a lot of folks going after this space, and we really want to just be that North Star that really is aligning with that health system, partnering with that health system, consulting with them to help them figure out how to win. And I don't say win in that they beat other people, win for themselves, win their margin back, win their cost back, win their people, and make them the employer of record in those markets and be the innovator in that marketplace. The tech agencies and folks have innovated, raised PE dollars and VC dollars to go innovate, to go build AI, to get better at sourcing eight nurses and
right.
techs. The hospitals haven't had those dollars to innovate. So how do we help them bring that technology to bear that allows them to be able to compete in a market where technologically they're behind?
Mm. What do you think? What have you seen with the clients that you have been able to serve? What have been some of those attributes that they've had to be forward thinking? Is it contingent upon the leader or the leadership team, or have there been other things that you've seen that are an indication that, hey, this will work?
It's usually the leadership, who's has a conviction that I need to solve this and will break barriers in the organization that are naturally put up because this isn't how we've done it before. So
Yeah.
it's partly that. Partly there's enough of pain. We had a customer who we found out about who signed with us over looking at four other companies, and their big problem was they wanted to start an internal agency, and they went through an audit and their compliance documentation for both their internal as well as their agencies. They never had an MSP. They never had their own dedicated organization to manage it. So there were some issues around their compliance and documentation and the agencies getting them the information they needed to show the compliance. And it caused a problem. Their number one problem was I need to manage my compliance better. It wasn't because I
Mm,
want to have an MSP. It wasn't because I want to do these things. I have to solve this problem. So there was a executive decision. We have to solve this problem. Go figure out how to best solve it. And we ended up, being the partner to help them solve that. And now what we've done is help them build an internal agency and managing their third-party agency all on one platform. And in fact, we're launching they were going to use their scheduler for their mobile solution. They basically said, yours is better. We'd like to work with you guys to help us manage the compliance better and some of the other aspects of the program. And so, it depends on the customer and again, meeting them where they are. What's your pain? What's your problem? And how can we help you with that? And then give us a right to get in here, prove what we can do, and then earn your business as you go.
So you and the team, you guys have had your fair share of tours of duty,
Many.
and you've learned along the way. And there, presumably, not everything is always wins. Let's maybe talk about some breakthroughs that have come as a result of some setbacks, some failures. Can you talk about any projects that maybe didn't go as planned, that rather that also led to some valuable insights and or unexpected success down the line?
That's a great question. I've never been asked about. The positive from our Prolucent platform is we've retained 100% of our customers. And I think that in a lot of,
That's not normal, by the way.
that's not normal, but I think the main reason this is not credit to me, it's our services organization and our know-how. We care about customers. We're not about that extra margin. We're out about, okay, we need to solve this. How do we need to solve this problem for them? And what resources do we need to put on this to make it happen? Let's solve it. Lost customer with less margin or a kept customer with less margin is better than a lost customer and more margin for a short period of time. So we're really
Right.
about how do we execute to solve these problems for our customers. I think there were a couple of times where we went in and the need changed from the health system, and we didn't identify that early up front. And that caused us to very quickly iterate our tech and our
Hmm.
platform to meet that need. Or they thought they could get that solution from another part of their ecosystem and very quickly said, we can't. And they asked all the partners who could do it, and we're the one that raised their hand and said, yeah, we'll do it. I think that's the other benefit of being a smaller company. We're continuing to innovate. And anything we bring in innovation we bring for one customer now becomes innovation that's available to other customers. So Houston Methodist, we're doing some innovative stuff for them. And then when we told Northwell and Dartmouth and others about it, they're like, hey, sign me up. I want that too. And so that's the other thing is we never stop. We're constantly doing a review of what can we do for that customer to help them solve more problems, create more operational efficiencies.
Yeah.
Once we get in there, we really start to understand where the bottlenecks are and can help work to try and resolve those over time.
It just sounds like you and the team are really nimble. And I'm just wondering, aside from your professional skills of understanding how to navigate the landscape, do you have any hidden talents or hobbies that have maybe indirectly contributed to the success or your success?
I think the thing that I have dedicated outside of work has been I have four boys, and I always wanted to be there with them, and they got into sports in a big way. I've got various age kids, and I became a leader of young people. I became a football coach, a basketball coach, and a baseball coach for 10 years. And when I lived in California, my nickname in town was just Coach. Everybody just called me Coach because I coached year round. I've now moved to Texas and I'm coaching my youngest son's travel team with my oldest son. And I put my son in a basketball program and they didn't have enough coaches. So I'm now the basketball coach. But again, I thought, so that's probably where out of the office I spend most of my time. And I think it's huge because I have the ability to impact young kids who, are getting started in sports and really understanding what culture and character, in a team and a commitment are. And how do you take that and instill that in young people? And then as they grow up into college kids, and my oldest played college baseball, and how do you instill in that and then take that same honesty and transparency and bring in that to your leadership of an organization and a company, and you're trying to inspire these kids, yeah, to do better or do things that they don't think they can do,
That's
right?
right.
I think leadership is similar. How do you inspire the people around you to think, how do we do this? How do we think outside the box and how do we fix these problems? And let's get together and bring our knowledge together to solve it. And I'm blessed at our company with the team that we have who has been doing this for 20 plus years each. And we focused on the same thing. How do we help health systems with their workforce challenges? And it's been a singular guiding light for us. So there's nothing we don't think we can do. Maybe we're probably, dreamers and some of that stuff, but
Right.
at the end of the day, we think there's a light at the end, and we want to, help be part of the ship that's rowing in the right direction to help these health systems.
It's really cool. They say that in 1 week, a coach can impact, more kids, more people in 1 week than most do in their whole entire lifetime.
I still get emails and letters and Christmas cards from kids that I coached who played D1 college baseball and basketball, and the parents still reach out to me and thank me for the time I put into their kid. And I can't tell you how meaningful that is to me. There's
Yeah,
nothing that means more to me than being able to do that. And then being able to do that for a company with employees and building a culture where we're really about solving problems and being there for our customers and doing the right thing, not only for our customers, but also doing the right thing for our people and our team. And that's why I love companies. It's like building that little T-ball team into a college team. How
that's
do you
right.
start at one place and work your way up? So
Yeah, it sounds like Prolucent Health it's got soul. It's got a
I,
soul and it's been able to build that. It's pretty cool.
I sit in our executive team meetings as we talk about the concerns our clients have and their needs, and just watching our people care and passionately try and solve the problems. And there's not a, wow, we shouldn't do this. Why are we
Yeah,
doing that? That's not our problem. That's not our, I don't hear that in our company. I hear, yeah, we can do that. We can figure it out. And we find a way to help them. And by the way, that knowledge then transfers to the next client and the next client and the next
right.
client. And so our clients make us better. Sometimes they make us think outside the box and help them differently ways than we thought that we
Yeah,
needed to. But at the end of the day, the collective of that value is benefited by all.
that's right. How can folks follow your work, Bruce? How can they, or maybe I should just keep calling you, I probably should just call you Coach. Coach, how can people follow your work, the work of Prolucent? Give us a little 60-second commercial to see how people can kind of follow what you guys are doing.
Well, you can obviously come to prolucent.com. Is that what you're talking about on our
Yeah.
social
Hmm.
media? We're on Instagram and LinkedIn and you name it. We have blogs about our work on our site. We have case studies of the successes we've had with our customers, for instance, Northwell or Dartmouth and others. And reach out to me, reach out to anybody on our leadership team if you have any questions or comments or concerns or things you're interested in chatting about. We're wide open to having discussions. And, you can talk to probably 5 or 6 of my executive leadership and get the same answers from them as you get from me. So
Right.
reach out to anybody on our team, and we're here to help and here to be involved and engaged and help build the process to find solutions.
Well, if there's anything that I left from today's conversation is that the future of workforce optimization is bright.
It
Good days
is.
are ahead. So for those that have tuned in, if you happen to find this conversation particularly valuable, particularly helpful, I certainly did. Let us know. Drop a like, send a comment. If you wouldn't mind doing that, that'd be really great. And Bruce, obviously, as you continue on the journey, we always leave the door open for guests to come back on and share more stories as they continue on their journey. So thanks for coming on and look forward to our next discussion.
It's been a pleasure. I appreciate it, Michael. Thank you for the invite.